I promise that we're not talking today about robots taking care of grandma. Or are we? Are you desperately trying to figure out how to support an aging family member while taking care of your own kids and managing work responsibilities? This show helps adult children to support aging parents by combining care skills, legal tools, and financial strategy into one show to save your sanity. If you are struggling to take care of your aging family member while taking care of your own family and maintaining your employment, this show is for you. The Later in Life Planning Show addresses care skills as well as legal tools in one show to save your sanity. Today, we're going to be taking a look at the role of technology in caring for an aging family member. And you're going to hear about how technology is really already pretty widely used in ways it never used to be. You're going to find out ways that it can be integrated into your plan to care for your loved one. And this might be counterintuitive to you, but you're going to hear about how this might actually enhance connection with other human beings rather than diminish it. Joining me to discuss age tech, as it's often called, is Brian Adler, a shareholder with the Rothkopf Law Group serving Philadelphia and southeastern Pennsylvania, as well as New Jersey. And I asked Brian to join me for two reasons. Number one, I know he's very keen on age tech and has been looking into this for quite a while and knows more on the subject than most people. But secondly, Brian Adler and his business partner, Jerry Rothkopf, go to great lengths to learn new and better ways to serve older adults. And so they very much deserve the stellar reputation that the Rothkopf Law Group has. So, Brian, on that note, I'm so happy that you joined me here today.
Patrick, it's number one, it's my pleasure. Number two, thank you for that introduction. That was very meaningful. And I agree. We try our best to innovate and expand our thinking. So it's to see the recognition is really valuable, to know those efforts aren't overlooked.
Even in the last year, traveling to a foreign country to see how things are done there, most attorneys are not going to set aside the time and resources to broaden their horizons like that. So,
That
yes.
was really something. We traveled to South Colombia, to Medellin and Bogota and Canoa to study their healthcare delivery system and their aging care delivery system. It was eye-opening to see how really Colombia is not third world any longer. It really is a developed country. It's really come a long way in the last 20 years. But to see how much better they do things in some respects compared to an advanced economy like the United States is pretty staggering.
I believe it. That's great. And on the subject, because you and I have talked about this at elder law conferences
Yeah.
and so forth, on the subject of the technology, and I'm not sure if how that fits in how they're doing things in Colombia, but certainly in the United States, people seem to either enthusiastically adopt technology into their daily lives, and
Yeah.
they'll even incorporate it into caring for a parent or other family member, or they just recoil from it. They just can't stand the idea of it. Age tech is here. It's becoming more prevalent. How do you discuss that aspect of it when you speak to people on the topic?
Patrick, that's a great question. And it's probably the one of the two biggest objections or concerns that we hear when we encourage use of age tech, particularly when it comes to seniors aging at home and how to use this technology in a non-invasive way. The biggest fear is twofold on the implementation integration. One is the privacy aspect of it. As recently as last week, there was this discussion of a Chinese hack of American telecom systems. So there's this constant drumbeat of insecurity with the technology. My initial response to it is, number one, you want to use a reputable provider that has integrated security measures. But you also have to look on balance, what is being provided? What is the exposure of information when you're using this type of tech? And that dovetails nicely into the fear of what is it, the intrusion of it. So let's use, for example, remote monitoring. Currently, the most frequent remote monitoring is camera-based. So there's a camera in the corner of the room and it sees everything mom, dad, sister, brother, husband, wife is doing.
Yeah, and
That is invasive.
there's good reasons to do that, by the way.
Wonderful
In case
reasons.
you're listening, for a family member of mine, at the moment of diagnosis of dementia, kudos to the geriatrician who made the diagnosis for immediately bringing up cameras for remote monitoring, and you can watch it from your phone. Now, we're not putting cameras in bathrooms, but cameras where a scammer might come to the front door, cameras where there could be a fall down steps. If the person is prone to wandering with cognitive decline, you can tell the police what clothing the person was wearing when they left the house.
There's no doubt monitoring can cut down on expenses. That's one of the things we'll discuss in a moment, that how technology cuts costs, but it's very invasive. The thought of having a camera on you when you're in the bedroom, when you're in the living room, places where there could be a fall, like a bedroom, that's a very private area. So there are new technologies that are radar based, similar to when you go to the airport through that scatter scanner. You don't see a human, you see this kind of squared out body that lights up parts of that where there might be a contraband. This is not really, you're not seeing what's going on. You're seeing a kind of a fuzzy being. So you don't necessarily see what mom or dad is doing, but you can tell if they fall into the floor. So it's much less invasive. That's radar based. There's also sensor based. We see this with a lot of frequency. There's research to support that an aging individual should enter the bathroom X number of times per day and be in that bathroom for Y number of minutes. So you can put a sensor at the door that tracks how often someone goes in. And if they don't go in frequently enough, an alert can go out. There might have been a fall, there might be some other issue. And the sensor is also triggered if the mom or dad doesn't exit in a certain amount of time. Most falls happen in the bathroom. You can also do with the refrigerator. So you can use these non-invasive techniques to get that information to loved ones in a much less intrusive way.
That's great. Yeah, because obviously, especially if we're talking about adult children, they don't necessarily want to see their parent not wearing clothing in the bedroom and so forth. But you can guard the safety and guard the privacy
Correct.
at the same time.
That's
But,
exactly
this
right.
is so you've already covered some really common examples where it's already being used and it's being used in a way that overcomes objections. In my mind, preparing to speak with you, I was just doing a mental checklist of technology that I've seen used with older adults. And it's everything from the cameras. It might be other wearable technology like
Oh yeah.
a glucose monitor that's a
An Apple
wearable.
Watch.
You're holding up one on your arm right now.
Oh, I will never wear an Apple Watch. I'm a bit of a
Okay.
Luddite. It's a regular watch. But Patrick, you're absolutely right. The Apple Watch, the amount of information that can grab and utilize in a closed ecosystem. So Apple's very good at protecting personal data. It's all encrypted on that device. It doesn't go, it's not stored anywhere. So you can have this watch that can check blood pressure, can check heart rate, pulse ox. All these things can happen in this little watch that we couldn't have done even 10 years ago. So there's these wearables. There's even a company, I believe it's called Skin, Skyn. They're developing a wearable clothing like underwear that can track heart rate, blood pressure, and the composition of your sweat to determine if there's a problem before it becomes an issue. There are wearables that use nanofibers that help restore mobility. So if you have a gait issue or a balance issue, these wearable fibers can help restore that mobility. So the wearables are probably the next real frontier in care support and care management.
It's here now, but it will get more sophisticated for an amazing benefit, predicting problems before they get out of hand. The cameras are there so you can respond, but how about having warning signs that something is developing? And there are the less widely used. I'm aware that they're out there, but the actual robots like
Oh yeah.
LEQ and Pero, the robot seal. And I don't know how they've been out a while, maybe because of cost. Anytime there's a new tech product, it's going to cost more until it becomes mainstream. Maybe that's why it's not in every house. I can at least understand that for a person who's lonely, to have this adorable seal around them might reduce stress and agitation. But I think the point, though, is that this will only get more sophisticated and people are legitimately thinking about you, the listener, and your family member and trying to devise solutions.
I played with both Pero, the seal, and I played with LEQ. So they're two dramatically different things. Pero, it's I would actually buy one for myself. He's really quite cute. He is designed, or she or it is designed to help those with dementia be soothed. The sounds it makes, the movement it makes, it's really a soothing toy as opposed to a companion. where LEQ is very much a companion. It has a non-humanoid head, and we'll talk about why that's important in a moment, but it's interactive, and it's becoming increasingly interactive from a discussion perspective, to the point where there's a lot of research and a lot of anecdotal evidence that seniors using LEQ develop such a bond when LEQs know they feel like it's a friend. Like they actually connect with this on a real human level. And research also shows the reason LEQ doesn't look like a human face is because humans are naturally react against a humanoid looking device. There's a Grace and Sophia are humanoid robots developed by Hanson Robotics out of Singapore. And they look like people, but it's very stilted in their movements, in their mannerisms, and it's off-putting
Sure.
to interact with that. But I encourage your listeners to look at Boston Robotics Atlas robot. Atlas looks like a robot. It has robotic looking features, has legs and arms and a head, but it's robotic looking. What this robot is capable of, it's unbelievable. It can instinctively pick up a dumbbell with this hand and an egg with this hand, which is one of the inherent problems with robotics previously, was how to judge that. We know how to do that, but how to do that robotically was very difficult. They've now breached that. They've now crossed that threshold. Atlas will be able to do wonderful, amazing things for seniors to relieve burdens on caregivers. And one of those objections we hear with robotic caregiving in particular, which I believe we're only 10 to 15 years from, it removes the human connection. And I couldn't disagree more. I believe it enhances it. So to use a relatively commonplace example, look at a nursing home. You have one aide, maybe two aides to 10 or 15 or even 20 residents. Let's say it's the minimum, it's 10 to 1. Those 10 residents have to get up, get dressed, brushed, toileted, and then down to breakfast, all within a 20-minute window, maybe a half-hour window. That's 3 minutes per resident with this aide. And this aide's got to get all those things done. If we can shift those responsibilities to technology, so that aide can thoughtfully and meaningfully engage with the individual, they'll be able to connect with that person and not feel so rushed to move on to the next one. So I believe it will actually enhance human engagement, not detract from it.
Yeah, that's great. And I'm glad you brought up the staffing numbers in nursing facilities. And even if we're looking at this from the older couple, so a couple in their 80s or 90s, how many times at the Rothkopf Law Group have you looked at a couple and you said, "Ma'am, if he falls, can you pick him up, or is that a 911 call?"
Exactly right.
And she won't have to worry about the physical strength component if something that can pick up a dumbbell can at least keep him steady and help with, so that's extending her life and keeping her injury free.
There's no doubt. It's the loved one, it's the actual caregivers, nurses, social workers, case managers, anyone that's actually doing any hands-on care. One wrong body mechanic and your back is out, your
Right.
shoulders are out, you fall yourself. I couldn't agree more. And technology, Patrick, as you know, is the only thing that gets less expensive as time goes on. People get more expensive. I was looking for an LED television for my bedroom. 55 inches is like $300. When these first came out, they were 3,000, four
Oh,
thousand,
sure. Yeah.
and it's gotten less and less expensive. As this technology becomes more ubiquitous, more widely accepted, it's going to become less and less costly, which can then we talk about the government financing side of things. It will bring those costs down. Medicaid and Medicare are the single biggest line items in the federal budget. If we can bring the human cost down, number one, we won't have to worry about minimum staffing ratios, which is a constant political fight. We don't have to worry about where to get those people from when Starbucks and Target are paying $20 an hour with 401ks and nursing homes are paying 15. We can use that technology. It becomes increasingly less expensive.
That is such a profound point. And I don't know that listeners really understand what we see all the time as elder law attorneys, where, that when people complain about poor care in a community or facility, most likely it has to do with turnover.
That's right.
And certainly if there's a change of ownership of the nursing home, that might lead to turnover. But you're right. It's just the market forces and how much Medicaid is reimbursing them. They can't pay as much as the Amazon warehouse that just
That's
opened
right.
up down the road. And so we're looking for solutions, and not only on the federal level, but on every state level as well. In every state capital at budget time, they're talking about the Department of Human Services, or whatever they call it in their state, and the amazing amount of money that goes to caring for people. This might be the breakthrough for for both quality of life and reducing the cost of care. So with all of that, I think maybe we still have people out there who are worried about that idea that and I think you alluded to this earlier, that nothing replaces human to human connection.
Mhm.
And you're talking about really, but I don't think I've heard you say it replaces the it enhances the
It
human
does.
connection.
Number one, it removes the worry. It removes that task oriented approach. Let's use a family caregiver. Let's use an adult child. The research shows that an adult child caring for an elderly loved one, a dying loved one, has this odd yin and yang to it, odd push pull. It's exhausting, it's overwhelming, but it's also empowering. This person's a dedicated caregiver, but they are empowered. They're better advocates for their loved one. It's worrisome because they might be doing the wrong thing, but it's also fulfilling because they're reconnecting with a parent in a way that they may never have connected. You are born, your parents take care of you, you move out, and then you have this sort of diasporated relationship. You never really switch. You never get to know your parent as a person. They're always superior to a subordinate. But it's a unique switch that happens when someone becomes aged and now becomes reliant on their child. It can be very empowering, but it's exhausting. If this person is constantly dedicated to the same thing we talked about, getting up, getting dressed, brushing teeth, brushing hair, bathing, going to doctor's appointments, you're losing that meaningful connection. If you can just offload some of that, person will be able to use that time for better fulfilling connections with their loved one.
For sure. Being the daughter instead of being the caregiver.
Bingo.
Because if you are the
Very well said.
caregiver, so many are always on call. And then that's when mistakes happen. And I've spoken on this show before with Jerry, the chief of geriatric medicine at Penn State Hershey, said just by off the charts, by far, the biggest cause of having to go back to the hospital after being discharged is a medication error, something falling through the cracks. And it's because one human being, and very often it is one adult child bearing the responsibility, they're not going to be perfect. And when they're fatigued, they will almost certainly make mistakes. What we don't want is the medication being missed, the medication being taken twice. So there's an
That's right.
overdose, technology to the rescue. We don't want people hurting their backs, technology to the rescue. And
Right.
then, as you've said so well, they can focus on being the adult child rather than really filling a
Being
professional
a caregiver.
caregiver role. Yeah,
And Patrick, to your earlier point, it's here. The technology's here. You can bite down against it, and that's fine. That's your prerogative, but it's not going anywhere. People were upset when we switched to electronic medical records, but it's here and everyone uses them. People were upset when iPhones first came out because it affected the BlackBerry. It's here to stay. All of these things, they're just here. The majority of the population wants it. Almost everyone needs it.
and I suppose there will always be that path forward for the people who don't want to adopt technology, or maybe there's a legitimate cost barrier, or who knows, in broad swaths of the country, there's broadband outages, they don't have internet access. That's fine.
That's a concern.
Yeah, they will make their way. It's not like this, you can't be a caregiver in the future without technology, but this is good for people to understand how it can enhance their experience with their family member and lead to a higher quality of life for everybody involved.
It's supportive, not replacement.
There you go. Brian Adler with the Rothkopf Law Group. If you are in southeastern Pennsylvania or South Jersey, look up the Rothkopf Law Group at rothkopflaw.com. Brian, thank you so much for your time today and your insights into age tech.
Thank you, Patrick. It was a pleasure.
I hope this episode has been helpful. If you need guidance specifically with a family member living with dementia, I can teach you how to manage communication, decrease stress, and improve quality of life. There is hope in skilled dementia care. Send an email to info@keystoneelderlaw.com. Remember, When you learn the tools to support a family member with dementia, you can do this.